Good evening, I'm Adrian Arsenault.
And I'm Andrew Chang. Tonight, the disturbing trend in COVID cases and concern we're creeping towards a second surge.
I believe it's coming, as sure as I'm standing here, and I hope to God I'm wrong.
From lockdowns to hospitalizations, a warning about what the fall could look like if people don't get the message.
A family's search for answers after that deadly boat crash involving Kevin O'Leary and his wife.
So it's almost like a slap in the wrist for them and a slap in the face for the families.
A CBC News exclusive.
Dangerous and deliberate vandalism.
I think it's just a very cowardly act that is just ridiculous.
A BC gondola cut down twice in 2 years.
An incredible discovery in the clouds of Venus.
This is just astonishing. Out of the blue, completely crazy.
Is there life on the planet next door? This is The National.
Flatten the curve. From the start of the pandemic, a public health slogan, a call to arms in the struggle against COVID-19.
Well, tonight, another clear signal. What's happening right now is the opposite of that. Ontario reported 313 new cases over the past 24 hours, more than 100 worse than the previous day, and the biggest one-day spike in months. Elevated case rates, now well established, not just in Ontario and Quebec, but also in Alberta and BC. The question facing officials is how much worse this gets. And that question is critical. As Christine Birak explains, the fear is that a spike in positive tests now could lead to far worse in the weeks to come.
It's not where anyone wants to be, but more Canadians are feeling sick. This mom came to make sure her daughter doesn't have COVID.
So we wanted to get her tested so that we don't have to all quarantine for 14 days.
Looks like you have to move for a second.
We have to move. We're moving.
So too is this virus. Over the past week, an average of over 600 cases were reported every day across the country. That's about 20% higher than the previous week. As it stands, cases have been steadily rising across Canada over the last month. The majority of new cases are now in Quebec and Ontario.
It's kind of like the perfect storm, everything coming together, school starting, second wave, flu season, economy. But folks, I can tell you one thing, we're going to hit some bumps, but we're ready for it.
Ontario's premier says it's possible there could be new lockdowns if cases keep spiking.
Let me be crystal clear. Every option is on the table. We will take every step necessary, including further shutdowns.
We're at 300 as of today. By the end of September, if we don't make changes, we could easily be in the 500, 600 range.
Another worrying trend, Canada's reproduction number is increasing. In Ontario, it's around 1.3, which means every 100 people with the virus will likely infect 130 others. Right now, hospitalizations are still relatively low because most new cases are in young, healthy people. But doctors say it's just a matter of time before others become infected.
The second ripple is going to be when they give it to their parents, when they give it to older people. Those people are going to start ending up in the hospital.
Which is exactly what hospitals are worried about. More people arriving here will inevitably lead to more people dying from this virus. Christine Birak, CBC News, Toronto.
So as COVID-19 cases continue to climb, are we facing a second spike? If we are, should another lockdown be the answer? We have a lot to get into with our doctors tonight. We'll tackle that and much more coming up.
Now, one source of outbreaks to watch, clusters of students newly arrived at university. 8 new cases have turned up at Western University in London, Ontario, and Ellen Morrow shows us the trouble that causes.
Hundreds of Western students lining up for COVID testing. So many, the testing center hit capacity just an hour after opening.
I don't really know when a good time would be to come because now it's like, it seems pretty obvious that it will be busy for the whole week.
None of the cases came from campus.
The pandemic isn't over.
But several have been linked to private gatherings and nights out like this.
So there clearly is a lot of activity in terms of COVID-19. Spreading in the student populations, but particularly large gatherings in bars and close quarters.
As university towns see students converge, there are fears those flouting the rules could fuel the virus's resurgence. A house party is to blame for outbreaks at 2 Quebec post-secondary schools. In Nova Scotia, at least 5 university students have been fined, 1 even expelled for not self-isolating.
We're not going to come out of this unscathed.
Ontario's Minister of Colleges and Universities asked students to call out their classmates' bad behavior.
A lot of that peer-to-peer type of monitoring is going to be required moving forward.
In the U.S., nearly 90,000 college students have tested positive. A crucial message for keeping numbers low here, say doctors, is that young people aren't immune.
Looked after a number of people who were between the ages of 20 and 30 who were very sick on a ventilator. So it's just important. We don't want that to happen to anybody.
Western's early outbreak is not surprising, say students frustrated with their peers.
One girl said she wanted to have a normal first year experience, and we're like, well, the more you do that, it's going to turn into a first week experience until we're all sent home. Yeah.
The last thing those students want when classes began less than a week ago. Ellen Morrow, CBC News, Toronto.
The Toronto District School Board, Canada's biggest, has once again delayed the start of online teaching. Classes were going to start Thursday, but an overwhelming surge in demand stopped that today. And this morning, Toronto's Catholic Board opened its physical classrooms. Jacqueline Hansen starts us there.
Today, the first wave of students in the Toronto Catholic District School Board returned to class.
We got new backpacks. Show them your backpack, Paw Patrol. Yeah. And his Ninja Turtle mask.
But rather than be here in person, Ontario families can still choose online learning instead.
I'm definitely prepared to change up my plans if I have to.
I'll see how it goes and we might change our mind, you know.
Thousands in the Toronto District School Board are making the last-minute switch.
A little over a week ago, we had about 56,000 students. Then it was up to about 66,000 students, and now we're at 72,000 students. So as you can imagine, that is a significant increase, and we need teachers.
The flood of students is forcing the TDSB to push back the start of its virtual school year again to September 22nd as it tries to find staff for 200 more virtual classrooms.
We're calling on our occasional teachers, our supply teachers, to see if they're available.
Jason Cunin was already set to teach at the virtual school, but he still doesn't know what subject he'll be teaching or which grade.
I think the board did the right thing. We needed this extra time.
Cunin blames the provincial government for not giving the board enough time to prepare.
I've never seen this level of chaos on this scale in my 25 years of teaching.
He's worried it will also shortchange his students.
I'm not going to be the kind of teacher I really want to be. None of us will be.
Ashley St. John signed up her older kids for online learning, but she says it's been a struggle to get information.
The fact that they're still planning, halfway into September is a little bit elementary.
The latest delay doesn't help her confidence in the system.
It just is postponing something that's already a little bit stressful.
A new school year and a new routine that will undoubtedly come with more challenges. Jacqueline Hansen, CBC News, Toronto.
Well, New Brunswickers have made their choice tonight after voting in Canada's very first COVID-era provincial general election. Kayla Hounsell is in Quispamsis, New Brunswick, at PC Party headquarters. And Kayla, Blaine Higgs of the Progressive Conservatives heading back to the legislature as premier.
That's right, and this election has really all been about Blaine Higgs's gamble. His popularity has been soaring due to his handling of the pandemic, and you can be sure the other 4 minority governments across the country are watching the results of this election tonight. He has managed to win that majority. He says he called this election during the pandemic because he needed the stability of that majority to lead the province through a potential second wave of the pandemic. Now, his opponents have been very critical of that. They've said this is nothing more than a power grab, but New Brunswickers don't really seem to have agreed with that. Liberal leader Kevin Vickers didn't even manage to hold on to his seat, and now he has told CBC News that he plans to step down from the Liberal Party of New Brunswick. He didn't have a seat in the legislature and was going for that for the first time. So, the result of this election itself, not terribly surprising, but so much about this election was pretty different.
Joanne Martin has been working elections for 25 years, but this one is different, and so is her job.
my job as a PPE constable.
She's one of 2 extra people at every polling station to make sure pandemic restrictions are being met.
I welcome you with bonjour, hello, good morning, good afternoon. Please hand sanitize. If you're not wearing a mask, we provide a mask for you as well.
Most said the process was smooth.
You could see them sanitizing everything. You were told to keep the pen with you and wrap it into a used basket.
Higgs has been under fire from opposition parties for calling an election during the pandemic, but today most voters said it was no big deal.
A lot of people wait for hours in Walmart. They see no problem there, so 5 minutes in there, well organized, was great.
Things were challenging for the candidates. Only election signs, no large rallies, and many decided not to knock doors. The advance voter turnout was at a record high, but for some, there's nothing like Election Day.
Democracy. It's very important that our voices are heard, so we can have a say in how the province is run.
Adamant voting is a must, even during a pandemic.
And Kayla, tonight Higgs addressed the fact that all eyes were on this vote across the country to see if it could be done safely.
Yeah, and it seems to have worked pretty well. There was some concern that some of the pandemic restrictions would create in really long lines that would then delay results tonight, but that didn't happen. People followed the rules, and the Premier-designate thanked New Brunswickers for that.
In this election, you, the people of New Brunswick, showed everyone that we are stronger together. You reminded us that we always rise to the occasion. You came out in historic numbers to vote in the advance polls. You followed the rules. You kept each other safe. Thank you for that.
And you heard the Premier-designate mention there that people came out in those historic numbers in the advance polls. There was a pretty significant campaign to get New Brunswickers to vote early. That seems to have worked. It seems to have helped things run pretty smoothly today, Andrew, in what is now Canada's first election during the pandemic.
Okay, Kayla Hansel, thank you very much. Well, Bloc Québécois leader Yves-François Blanchet is self-isolating tonight, as are members of his staff and caucus, after a staff member tested positive for COVID-19. Now, that person works in Blanchet's office. The party says everyone will be screened and that caucus and staff will work virtually for now.
More than a year after a deadly boat crash on an Ontario lake involving Kevin O'Leary and his wife, the family of one of the people killed says they are still fighting to understand exactly what happened. Katie Nicholson with their push for answers and accountability in the CBC News exclusive.
These joyful moments, a small window into the last weekend of Susanna Brito's life before being killed in a boat crash in these same waters.
She's the first person that we think of each morning and the last person before we go to sleep.
Speaking publicly for the first time since the crash, Paula Brito remembers her sister as joyous and an involved mother to her 3 kids.
She didn't just send them off to play. She got in there, got her hands dirty.
More than a year after her death, the sting of loss lingers, as do unanswered questions. Susanna was on board a boat on Lake Joseph, owned by Irv Edwards and piloted by Richard Roux. Another speedboat driven by Linda O'Leary, wife of entrepreneur Kevin O'Leary, crashed into it. According to search warrants unsealed by CBC News, Linda had alcohol in her breath, but claims she had a drink after the crash. Roux, on the other boat, was charged with failing to exhibit navigation lights. Susanna and another passenger died from their injuries.
We're in the dark. We don't have any information about what happened exactly that night.
Paula even went to court to try to get details from police and prosecutors, while also filing a wrongful death lawsuit against the O'Learys, Roux, and Edwards. They all filed separate motions in federal court denying responsibility for the crash and asking damages be limited to $1 million. Despite that, in May, the O'Learys filed a $3 million lawsuit of their own against Roux and Edwards for pain and suffering and lost earnings. All declined comment through their lawyers.
I feel that there hasn't been any accountability for what happened. So it's almost like a slap in the wrist for them and a slap in the face for the families.
No answers, no accountability, and for now, no closure. Katie Nicholson, CBC News, Toronto.
A small village in New Brunswick is grieving the loss of 3 teenage boys tonight.
You know, everyone's just so upset, so sad. It's just terrible, terrible news, terrible state to be in.
2 17-year-olds and a 16-year-old died in a crash over the weekend. Police said their car went off the road and struck a retaining wall. Grief counseling is being offered at their high school.
Holy!
A train carrying potash derailed near Hope, British Columbia. CN Rail says at least 20 cars went off a rail bridge, some falling into the water. Fortunately, though, there were no injuries or fires and no dangerous goods involved.
Within 12 minutes, the fire was huge. It got huge. There was plumes coming.
And in New Westminster, BC, a major crimes unit is investigating after a fire destroyed parts of the city's historic pier last night. The flames sent dangerous smoke into the sky, already hazy from U.S. wildfires. 3 nearby schools and some businesses were closed for the day.
A popular tourist attraction north of Vancouver has again been targeted by vandals. For the second year in a row, the Sea to Sky Gondola in Squamish has had its cable deliberately cut. Operators are bewildered, the town is crushed, and as Tina Lovegreen explains, the motive remains a mystery.
It's hard to make out from a distance, but that is the gondola cable dangling down the side of the mountain.
This event mirrors last year's event in a very eerie fashion. So the mechanism, the time, all of it very closely reflects what happened last year.
No one was hurt when vandals cut the thick cable in the middle of the night, sending some 30 metal cabins crashing down.
We struggle to understand the motivation of an individual who do this.
It was 13 months ago that the attraction saw its cable snapped the first time, causing upwards of $5 million in damage. Still, no one has been arrested.
After last year's incident, operators beefed up security, adding more cameras and sensors, and they're confident that those changes will help police get the information they need. But this smoke is adding an extra layer of difficulty.
I think obviously the smoke will hamper some of the things, but I think it's already been put out that the gondola does have CCTV footage.
The town stunned that this could happen again.
I think it's just a very cowardly act.
It's devastating. They worked so hard to get it back up and running.
More just feel bad for everybody that works up there, right? Like all the jobs that are lost because of it.
But maybe no one is disappointed as Gavin Johnston and Haley Stringer. They were supposed to get married up there in a few days.
It doesn't seem real to me. I still can't believe we're having to replan our wedding for the 3rd time. But it seems very surreal.
Their first plan was canceled due to COVID, and now Plan B has fallen apart. But just like they aren't letting this stop them, the operators of the gondola vow to rebuild again.
We'll take our knocks, but we will always get back up.
With even more security measures in place. Tina Lovegreen, CBC News, Squamish, BC.
So that smoke Tina mentioned is still thick over much of BC, despite hopes it would clear.
We're certainly not going to be as poor of air quality as we've seen for the last 4 days, but it's going to drag on. We're not going to be totally out of the woods.
In fact, it remains bad enough that Canada Post has suspended mail delivery across much of southern BC. The smoke is now expected to get a bit better later in the week. Parts of BC have been seeing some of the worst air quality in the world, all due to a record wildfire season across the U.S. West Coast.
Donald Trump arrived in California for briefings on the wildfire response, a classic presidential moment to rally the country around a common cause. But Paul Hunter shows us, like so many things, disasters in the U.S. are intensely political.
With the U.S. West Coast still under that haze of thick, choking smoke, and as firefighters struggle to contain those raging fires, the other battle, the one over blaming this on climate change or to deny climate change, was likewise heating up fast. Joe Biden today slammed Donald Trump as a denier who's making things worse now and threatening an even deadlier future.
If you give a climate arsonist 4 more years in the White House, why would anyone be surprised if we have more America ablaze?
Today in California, to assess things for himself, Trump again blamed poor forest management, not climate change, as the key contributor to the fires.
When trees fall down after
a short period of time, about 18 months, they become very dry. They become really like a matchstick. And they get up, you know, there's no more water pouring through, and they become very, they just explode. Later, at a briefing on the fires,
we can agree to disagree.
California's governor seemed to practically beg Trump to see things differently.
Climate change is real, and that is exacerbating this.
We've had temperatures explode this summer.
And to a president also accused of ignoring science on the COVID pandemic, some today framed their climate concerns as a dire warning.
If we ignore that science and sort of put our head in the sand and think it's all about vegetation management, we're not going to succeed together protecting Californians.
Okay, it'll start getting cooler. You just watch.
I wish science agreed with you.
Well, I don't think science knows, actually.
On that, say experts, Trump is just plain wrong. Tonight, at a panel discussion in Arizona with Trump, the crowd on hand chanted loudly, 4 more years. Paul Hunter, CBC News, Washington.
Tropical storm Sally strengthened off the coast of Florida today to become a hurricane.
Continue to monitor the weather, but be prepared for the worst case scenario.
People in Louisiana and Mississippi are under evacuation orders. Sally is expected to make landfall tomorrow, bringing life-threatening storm surges and powerful winds. It's the second storm in less than a month to threaten the region.
A new alarm bell is ringing in the Arctic. Scientists say it is now transitioning out of a permanently frozen state into an entirely different climate. As Greg Rasmussen tells us, it will soon be warm enough for a rainy season.
Drilling deep for answers. These researchers are measuring changes in the ice in Canada's north. Part of an overwhelming flood of data used in a new study that reveals a line is being crossed into uncharted territory.
The Arctic climate is changing dramatically and rapidly, and so much and so fast that it is transitioning to a new climate.
A climate with more rain and less snow, where temperatures have trended up and show no signs of reversing. Ice covering the oceans is shrinking dramatically.
That's a matter of 1 to 2 decades, a change that is so rapid that it's statistically putting it into a different regime. And that is, that's astonishing. That's astonishing.
It certainly has the potential to be incredibly impactful for people.
The shrinking amount of ice has this climate scientist of Inuit descent worried.
And we haven't done a great job in this country and many northern countries in preparing for climate change.
And you could see that there's some snow out in the mountains.
For people in the north, the stakes couldn't be higher, with worries about the impact on wildlife, communities, and people.
And just knowing that these ice conditions are changing and are a lot more dangerous than they were before is kind of scary. And you're just worried the whole time that you have loved ones or friends out on the ice because you're worried for their safety.
As if to underscore today's report, in Greenland, a 110 square kilometer chunk has broken off the country's largest ice sheet. One more sign of climate trouble. Greg Rasmussen, CBC News, Vancouver.
Well, Vancouver-based outdoor retailer Mountain Equipment Co-op has approved a deal to be sold to a private U.S. investment firm. MEC, as it's known, has been Canada's largest consumer cooperative with more than 5 million members. The board of directors said the deal was necessary to ensure a future for the retailer, which was hit hard by the pandemic. The deal is expected to close later this year.
As families across Canada navigate back to school, we look for tips from a country where kids have been in class for months.
Take a deep breath and let them go back.
Next on The National, what lessons can Canada learn from Denmark's success?
We all know that a second wave of this virus is coming.
COVID cases are climbing. Concerns of a second wave are growing. The doctors weigh in on what can be done.
And the discovery that suggests there could actually be life on Venus.
This is just astonishing. Out of the blue, completely crazy.
We're back in 2. Welcome back. As schools reopen, the pandemic puts the focus on student safety, but we're also living through a broad awakening to racial inequality that demands more inclusive education. Some Black parents fear that need will be lost amid the safety scramble. Deanna Sumanak-Johnson shows us how they are taking charge.
One of the areas that I want us to really look at is the life of Maya Angelou and some other amazing writers.
Shanette Martin had already pulled her daughter from one school because she was experiencing racism. Now she's once again taking matters into her own hands, ensuring that 17-year-old Celeste is learning about the Black experience in a way she didn't find in Ontario's curriculum.
I worry that teachers are bombarded with keeping our kids safe, as they should be, which is priority number one. But we still have the legacy of anti-Black racism that's always been there. The sad thing is,
Martin, who used to work as a teacher, has set up a learning pod in her basement for her daughter and a few other high school students.
If I have to use a novel study, I'm going to find a novel study that is diverse. If we're talking about science, I can bring in inventors.
Martin's solo efforts are exactly what this Toronto teacher knows it takes when inclusion of the Black experience in lessons isn't required.
I've always led with an anti-Black racism lens and a culturally responsive pedagogy.
But it's not something all teachers can or want to do. He learned that last week when the province mandated a professional development day on anti-Black racism. I've
heard about some pushback, and again, it really takes place and centralizes at where people are at in their journey of learning when it comes to anti-Black racism. We got a ways to go.
In Nova Scotia, kids are no longer limited to just a single Black history course.
Now we are embedding African Nova Scotian curriculum into science, into math, into phys ed. So when we can speak to all students rather than the 20 that take the course, it's better for us.
Be strong! Be strong! But even there, families seeking change now have sought out more independent education.
You are special.
The African Nova Scotian Freedom School, a month-long online school focusing on the Black experience in the province, graduated its first class at the end of August. Getting creative until the change comes so that the fight for equality in education doesn't take a backseat to fears of the pandemic or of change itself. Deanna Sumanak-Johnson, CBC News, Toronto.
Well, with COVID-19 cases climbing in this country, officials are already warning what could be next.
We all know that a second wave of this virus is coming.
But is it really? And if so, how might that change our lives yet again? We put those questions and more to our panel of doctors right after the break.
And later, why scientists now say there could be life on Venus. An exciting discovery still to come.
Whether this is the start of the second wave or not, it certainly has our attention and we are dealing with it.
Every day, the question feels more and more urgent. What the second wave of the pandemic might look like. With kids going back to school, others heading back to work, and a flu season just weeks away, there are fears that cases could spike in many provinces if they haven't already. But what can we make of the rise in cases, and how can we prevent things from getting out of control? Joining us now to talk about this are infectious diseases specialists, Dr. Lenora Saxinger and Dr. Zane Chagla. Hello to the both of you. Dr. Saxinger, maybe we'll start with you with a viewer question, and this is one that I know are on a lot of people's minds. When will the second wave hit? And that's assuming you think there is a second wave coming.
Well, I think a lot of people think there will be an increase in cases in the fall because all of those things we've been dutifully doing outside, we're now shifting inside, and there's likely increased risk of transmission. And I think a wave is actually easier to see than to actually numerically define. The three main patterns that we see people talking about are a second spike, which might be higher than the first spike, kind of a series of smaller waves possibly related to the public health interventions that are going on in the background. And then finally, the idea of kind of a slow burn that might go up and down, but have a more kind of constant nature. And at the moment, it's really anyone's guess. And I think our actions over the next little while may make a big difference in what we see, honestly.
And Dr. Chagla, if there is this sort of second major uptick in cases, do you see it as being fundamentally different from the first? I mean, back in March?
I mean, I think the one major difference between now and then is our testing is much more up to speed, so that even the mild symptomatic cases in the community are being identified. So back in March and April, where only really the hospitalized, the vulnerable ended up getting tested, we're going to be testing pretty much everyone with symptoms, hopefully, who's able to present. So I think the numbers are a bit more sensitive now, and so really small variations are going to be picked up very, very quickly, rather than seeing those numbers being associated with a significant amount of hospitalization and death that we saw in the first wave.
Right. So that's good news. But Dr. Saxinger, the basic problem is what? I mean, is it that people just aren't getting the message? Is it that they're relaxing their guard, or is it just isolated events? What do you see as being the issue?
Well, I think we've seen a shift in the transmission from specific groups like long-term care and vulnerable workers into kind of more community-based spread. And then trying to find that down, we see the demographic across Canada has been in younger people who are less likely to hit hospitals, so that's good news. In other places, we've seen that same demographic kind of start with the community transmission numbers, and that story evolve to spill over into more vulnerable groups. And so identifying the why is very important, and trying to target the activities of prevention and the messaging to the right groups is important, and avoiding stigmatizing, because some of these people might be, for example, workers in places that are open and need workers. And so we can't attribute it all to social events, for example, particularly. Having said that, I think we can probably fine-tune our messaging to give people stronger guidance about what's okay and what's not okay as we move into the fall.
Right, and Dr. Chagla, just on that, I mean, when you think about the frustration that I think a lot of people are feeling, those people who are taking the pandemic seriously and who are continuing to physically distance and isolate themselves, this feeling that they sort of feel doomed to whatever it is, the sort of smaller population, the people who just are more relaxed, you know, they're going out, they're not physical distancing. Are they sort of doomed to fall prey to whatever it is that, I don't know, an irresponsible group of people do?
I mean, it's difficult. You take that group and you try to put yourselves in their shoes. They're a group that's been losing some of their life experiences, universities closing down, having difficulties with employment, losing their social structures, being able to interact with the people they normally do. They're a tough group to reach for a lot of public health interventions, just because they're of that age where they tend to feel more invincible. You know, they know, and I think rightfully so, we've learned more in that first wave that the risk of someone under 40, certainly there are cases that get very sick, but it's not particularly many. And so, you know, those combine into a group that's hard to reach. And really, the interventions that have to be in place for that group have to be very age appropriate. They have to be targeted to that group through whatever means and media they consume. But also, they really need to be understanding of risk mitigation in that group, that they're going to want to do those life experiences and those things that they want to do. How can we make that safer for them? How can we get them outside of their close gatherings or social events and put them in places where they can still have that type of interaction without being as unsafe? So, you know, it is a difficult group to reach, and there's a lot of work to get there. But I don't want to say that they've doomed everyone in that sense. They're one of the many groups that's a part of this.
Dr. Chagla, you know, on Instagram, we got this question. With cases steadily increasing, is a lockdown appropriate? I guess a re-shutting down of things.
I think in March and April, when we went through this, there was a serious worry about our healthcare system being overwhelmed. We saw what was happening in China and Italy and New York. We are in a publicly funded healthcare system. There's a limited amount of resource that we have. And so there was this concept of flattening the curve, that we just had to get things under control as fast as possible, such that our healthcare utilization could come under what our ability to process patients were. I think, you know, learning now, us having better testing, understanding the disease more, that last resort scenario is the last resort. It's going to happen again when we're getting to the point where healthcare utilization is getting out of control. But everything to that point can be staged interventions, can be learning from the epidemiology, can be tracing cases, can be really focused interventions regionally, rather than necessarily putting everyone out and really having that economic and physical and even medical damage that lockdown did. So it is a last step, but I think it's one step that we take, again, after everything has been exhausted to that point.
Right, because Dr. Saxinger, I guess before then you might see what? Something like school closures on a temporary basis, or what else?
Well, I think that we'd want to look at data from elsewhere and help that guide the interventions that seem to be the highest yield. And so we'd probably want to see, what areas have the highest transmission within the community, and then gear the lockdown appropriately. And in some places, that might focus more on certain businesses, restaurants, bars, and other. And I think that we would really look to closing schools as being kind of a later step, because I think preserving the school experience for children is also very important for their health and development. So I think it might not be one size fits all, basically. And knowledge of how things are evolving in different places will definitely inform any decision like that. And I don't think there's a magic number at which you'd say, now we do this. I think that it is all very context dependent in the communities. And so the communities can kind of pull together to sink or swim. If we can control transmission without shutting things down, then it's not on the table anymore. And I think that's an important thing for people to remember.
Okay, good final thought there. Doctors, thank you so much for your time.
Thanks.
Thank you.
Next, looking for lessons from a successful return to school.
We're trying to do things as normal as possible, not scare any kids.
Students in Denmark have been back in class for months now. What can we learn from their experience? Welcome back. Denmark was one of the first countries to open up schools, doing so in the spring, and now children are walking into classrooms that are beginning to look a lot more normal. Renee Filipponi takes us to Copenhagen to show us a largely successful school reopening.
It's a full house for this 5th grade class brushing up on the finer points of Danish. Kids here are back for their 2nd semester during a pandemic. Physical distancing isn't a priority. Teacher Jens Rogard's style is hands-on.
For proper teaching, we can't do that with a distance. But right now, that we're trying to do things as normal as possible, not scare any kids.
How many times a day do you wash your hands?
The students at Alholm Public School in Copenhagen are eager to brag about their hygiene. Though staff say they need constant reminders. 12-year-old Seda is happy to be back at school.
It's really fun to have your friends again and talk to them and play soccer.
Fun, yes, says her classmate Jeppe. They both agree, though, they were nervous at first.
I was a little bit scared because nobody knew what this was. And what could happen if you get sick? It was really hard a bit and you cannot stop thinking about it, but it is what it is.
The rules haven't always been this relaxed here. Headmaster Soren Witt says when they first opened in April, it was strict.
Each class was divided into 3 groups, and they all had their own teacher. So there was a lot of planning in that. And the breaks also, we divided the breaks.
A number of schools have had COVID cases, but 4 months on, the back-to-class plan in Denmark is seen as a success.
In this phase of reopening, it's been left up to individual schools to design their own plan. Here, it really feels like pre-COVID times, and the headmaster says that's the point.
With small pupils, there is a very little risk. I think they should take it easy and follow the rules, keep the distance, be aware of the hygiene and the pupils' hygiene, and then I think things will work.
Denmark, a country of not even 6 million people, was able to avoid the mass outbreaks seen in other parts of Europe by going into lockdown early. Schools were ordered open before bars and restaurants. And because kids were back in class so quickly, countries around the world, including Canada, have been asking for advice.
It's a good story about cooperation.
The teachers' union collaborated with the government and says staff concerns were addressed early on.
So that parents met teachers who felt safe about this, telling them that we can cope with this situation. That also made parents feel safe.
The evidence overall is that it's a pretty safe place to be.
This virologist says it's more than planning that's preventing future outbreaks.
Most of the evidence point to the fact that even though children can become infected, they are not getting severely diseased, and also they do not transmit the disease for reason we don't know.
Like much of the world, Denmark has a surge in cases right now, mostly among people in their 20s, so the government has reintroduced some restrictions.
I think we have become too relaxed, And I think we might be victim to our own success, sort of, because we'd never experienced how bad this epidemic could be.
That relaxed attitude on show right at the school's gate. Danish parents take it all in stride and offer advice.
Take a deep breath and let them go back. And if something happens, you take their precautions, and one class might be at home for a week again, but life needs to go on.
For now, in Denmark, it does go on, which for the moment may make this country the envy of the world. Renee Filipponi, CBC News, Copenhagen.
Well, next on The National, new hope there is life on other planets.
This is just astonishing. Out of the blue, completely crazy.
What scientists have found on Venus that has them so excited. Well, more than half a century of space travel has not yet allowed us to answer one of the fundamental questions of exploration beyond Earth. Is there life on other planets? Now, as Aaron Saltzman tells us, scientists say there could be in the clouds of Venus.
Venus, Earth's sister planet, similar in size and mass, and now the stunning suggestion it might possibly be similar in another way as well.
This is just astonishing. Out of the blue, completely crazy.
Because scientists, using some of the most powerful telescopes on the planet, have found something in the atmosphere of Venus that shouldn't be there, a rare molecule called phosphine.
Phosphine's not a natural byproduct of any chemical process. It takes energy to make it, so you don't spontaneously get it.
On Earth, phosphine is produced in only two ways: industrially for use in things like pesticides, or by tiny organisms known as anaerobes that can live in oxygen-free environments. It might be possible for phosphine on Venus to come from, say, volcanoes or even lightning, but scientists say that would produce about 1/10,000th of the amount they found in the atmosphere. For some, that leaves only one possibility.
If there's a gas that doesn't belong, that's in way bigger quantities than it should be, we can say that it might be associated with life.
Life, alive right now, astoundingly enough, in the form of microbes surviving in Venus's highly acidic clouds. But some are skeptical.
We already know that there's weird things going on in Venus's atmosphere. And so the most likely scenario is that this is just weird chemistry happening in Venus's atmosphere rather than a whole new branch of life.
And yet,
it's exactly the kind of finding that I would expect to be the first sign of an extraterrestrial biosphere on another planet.
Our sister planet, holding what might be the first evidence that we're not alone after all. Aaron Saltzman, CBC News, Toronto.
Next on The National, a first day of school surprise. What this 7-year-old grew all summer just to give to his teacher. Well, it sounds a bit like Jack and the Beanstalk. 7-year-old Landon spent the summer growing sunflowers after his teacher gave him seeds in June. And boy, did those seeds ever grow. What he brought back to his teacher on his first day of school is our moment.
It was probably the beginning of June when we were allowed to start doing porch visits. I hadn't seen the kids and I really wanted to see them. So I thought it would be really neat to give them each a package of seeds. And in that package, along with some other things, were the package of sunflower seeds.
I just planted them. My dad told me that I should bring another seed and just gave one back to my teacher.
I was really surprised. I never expected a sunflower that big or tall. It was around 12 feet tall, so when I saw it, I was just amazed because it was so heavy too, and it's so thick, and it was just so cool. And he was pretty proud of himself that he had grown that. We couldn't even put it up tall because it was too tall for the ceiling. And I'm like, how did you carry this? But he did. He managed to carry it in and bring it right into me on his own and show me, so I was really surprised.
So a better question might be, how did you grow this?
Yeah,
So the reporter in PEI, Sarah Kivany-Voss, asked a good question. Landon, how'd you do this? And he said, and I quote, he wants to thank his mom for helping him plant the seeds, his dad for, quote, growing the cows, and the cows for producing the poop.
Oh, okay. And not to take anything away from Landon's accomplishment, though, we did Google what the tallest sunflower, do you want to?
No, it's all yours.
30 feet. Can you believe that? But 12?
Not bad.
Amazing. That's the National for this September 14th. Have a great night.
Good night.